Hello viewers, welcome to my channel. If this is the first time you're clicking on my video, hi, I am Puspen Dasgupta, an Indian ENT specialist, and I upload new videos on YouTube at 9 p.m. Indian Standard Time every day of the week. Each day of the week subscribes to a particular theme. The theme for Monday, that is today, is MS-ENT. On Mondays, I talk about some frequently asked questions in postgraduate ENT exam, especially theory exam, because I have noticed both during my post-graduation and my tenure as an assistant professor that postgraduate ENT students particularly have difficulty with framing theory answers that can be both comprehensive enough to get good marks and succinct enough to finish writing in 15 minutes. The university where I completed my post-graduation had a system of asking 10 questions for each paper. There were total 4 papers and each question paper was of 3 hours duration, which largely meant one answer should have been written in the duration of 15 minutes if we had any legitimate hopes of completing the entire question paper. Now imagine writing a 10-mark answer in 15 minutes. That's not an easy task. So I decided that I will prepare some sample answers which might help build the foundation for better answers written by postgraduate ENT students who find the time to watch my videos. Also, I want to tell you this, that there is no such thing as MS-ENT question, an MBBS ENT question or MRCS ENT question. There is only ENT question. There are only ENT answers. There is only ENT information. It doesn't really matter which stage you are in, you might be asked any question, just that the expectation from you, from the examiner, will be slightly different. For example, a question on otosclerosis was asked in MBBS theory exams and it is frequently asked in MS-ENT theory exams from age immemorial. So the same questions can be asked. Now in my career as an ENT specialist, I encountered ENT questions at 3 stages. During MBBS ENT exams many years ago, during MS-ENT exams 5 years back, and during MRCS ENT a year back. Most of those questions were similar in nature, but the one topic that was common across all these 3 exams was laser. Now I don't know why laser is so commonly asked, but it is probably the most frequently asked question in ENT. And one of the most frequently asked laser question in ENT is, which is the most frequently used laser in ENT? That the answer is CO2. Anyway, so we will talk today about lasers because it is a very frequently asked question in postgraduate ENT exam, and if I had to make a prediction without having any role to play in setting up the question papers for postgraduate ENT exams, I can predict that a question on laser is most likely going to be there in the upcoming theory exams for MS-ENT in December of 2024. So without further ado, let's talk about lasers in ENT. I will try to answer 6 questions on lasers that I have come across during the brief research that I conducted before preparing this video. I'll read those questions and then I'll try to answer them to the best of my ability. Let's get into it. What is the principle of laser? What are the different types of laser used in ENT? Enumerate their clinical uses in ENT. Discuss precautions and complications of carbon dioxide laser. Now, while the question is discuss precautions and complications of carbon dioxide laser, I am going to discuss precautions and complications of all lasers. What do you mean by tissue effect? What are the advantages of ND-YAG laser over other types of laser? Before I get into the answer, the disclaimer is that this is the answer that I have prepared and I don't claim this is the best answer that anyone can prepare. Please go through the answer, and if you find any mistakes, please feel free to point out in the comment section below, but I have prepared an answer to the best of my ability and I don't think there are any factual inaccuracies here. However, I would love to learn from you. So let's start the answer. First thing we answer is principle of laser or laser principle. Before we answer that, we should address the fact that laser in fact is an acronym. It is not a single word. Laser stands for light amplification by stimulated emission of radiation. So laser is in effect an electromagnetic radiation, or for simplicity's sake we can think of laser as a light beam. Now what is the effect of laser beam on tissue? it can have four kinds of effect. It can be reflected, as seen in A, it can be transmitted, it can be scattered, and it can be absorbed by the tissue, resulting in tissue destruction. Now let's discuss the principle in greater detail. Atoms are in stable form at rest. At rest, the number of protons equals number of electrons. Now these electrons revolve around the nucleus of atoms in a fixed orbit. Now atoms become excited when given energy. Electrons change their orbit and they move away from the nucleus. Atoms release their absorbed energy automatically. This is called spontaneous emission. Atoms return to their original state. Photons or light, or in this case laser, strike excited atoms, resulting in accelerated decay of atoms. Now both the incident and the absorbed photons are released. This is called stimulated emission. Remember, light amplification by stimulated emission of radiation. So we have got the light, that is the photon, we've got the stimulated emission. Now all we need is amplification of the stimulated radiation. This amplification of stimulated radiation is achieved with the help of mirrors. So light beam hits the atom, radiation is emitted, and the emitted radiation is amplified by the use of mirrors. Now laser is an electromagnetic radiation. Now each type of laser has its own wavelength, which depends on the type of material, lasing material. So let's discuss the types of lasers. Argon has a wavelength of 488 to 514 nanometer. KTP or potassium titanyl phosphate laser has a wavelength of 532 nanometer. Nd:YAG has double the wavelength of KTP, that is 1064 nanometer. Carbon dioxide, the most commonly used laser in ENT, has a wavelength of 10,600 nanometer. Holmium-YAG has a wavelength of 2100 nanometer. Erbium-YAG 2960 nanometer. Diode laser 600 to 1000 nanometer, and tunable dye laser 577 nanometer. So lasers can be classified in terms of their wavelength. They can also be classified in terms of visible laser and invisible laser. Examples of visible laser are lasers falling in the range between 380 to 760 nanometer. Due to laser light being visible, these types of laser do not require a separate aiming beam to focus them, because you can see it. If you can't see it, then how will you use the laser to focus? Now examples of visible laser: argon laser and KTP laser. Argon laser has a blue color and KTP laser has a blue-green color. Now we also have invisible laser, which can fall in the ultraviolet zone or it can fall in the infrared zone. If it falls in the ultraviolet zone, it has a wavelength between 1 to 380 nanometer. For example, excimer laser that is used in LASIK surgery, which has a wavelength of 193 nanometer. Infrared zone can be near infrared from 760 to 2500, examples being Nd:YAG and holmium-YAG, or it can be mid-infrared, erbium-YAG and carbon dioxide. No far infrared lasers exist. Now lasers can also be described as those which can be transmitted through optical fibers. There are some lasers that can be transmitted through optical fibers, such as argon laser, KTP laser, Nd:YAG laser, erbium-YAG laser, holmium-YAG laser, and diode laser. Important laser that cannot be transmitted through optical fibers is carbon dioxide laser. Now we talk about the clinical applications of laser. Clinical use of laser is determined by wavelength of laser, selective absorptive property of tissue, ability of laser to pass through flexible optical fiber, mode of delivery, whether it is continuous or pulsed. Now first we will talk about argon laser. Now we could have approached clinical applications of laser by talking about the applications and then mentioning the laser that can fulfill those applications. Or we could have just taken up the lasers and then talked about where they are individually used. It is up to you how you choose to approach it. For example, you can go for stepidotomy. These lasers can be used. Excision of tonsillectomy. These lasers can be used. Or you can go the other way. Mention the laser and mention its uses. I chose to mention the laser and mention its uses. So we'll start with argon laser. Argon laser lies in the visible spectrum, blue-green in color. Wavelength is 488 to 540 nanometers. It is easily transmitted through cornea, lens, vitreous humor. So it's very important to know which tissues transmit the laser, which tissues absorb the laser. So, argon laser is transmitted through cornea, lens and vitreous humor. Argon laser is absorbed by hemoglobin and pigmented tissue. Argon lasers can be delivered by optical fibers. Argon laser is used to treat port wine stain, hemangioma and telangiectasia. Argon lasers can vaporize target tissue when focused on a small point. Now, argon lasers can be used to create a hole in stapes foot plate but requires a drop of blood for its absorption at that site so that it is not reflected by white bone of stapes foot plate. Which surgery is this? Stepidotomy. Next we move on to KTP laser, potassium titanyl phosphate. KTP laser also lies in visible spectrum. It has a blue-green color. Now I think I mentioned previously that KTP laser has a blue-green color and argon laser has a blue color. I think blue, green and blue are quite close, so you can go with either of them. Wavelength of KTP laser is 532 nanometer. KTP laser is absorbed by hemoglobin. KTP laser can be delivered through optical fibers. Clinical uses of KTP laser are in stapes surgery, endoscopic sinus surgery for removal of polyps, inverted papilloma, vascular lesions. Also, vocal cord polyps can be removed by KTP laser using via microlaryngeal surgery. Other microlaryngeal surgeries for cyst removal, papilloma removal, contact ulcer removal, laryngocele removal, removal of early malignant lesions in the vocal cords, removal of tracheobronchial lesions through bronchoscope can be done with KTP laser. Now we move on to diode laser. Diode laser has a wavelength of 600 to 1000 nanometer. It also can be delivered by optical fibers. Diode lasers are moderately absorbed by melanin and hemoglobin. Diode lasers are used in turbinate reduction, stapedectomy and mucosa intact tonsillar ablation. Now we move on to the workhorse laser in ENT. Having said workhorse laser in ENT, one would like to imagine that we have so much information about lasers in ENT and we are forced to have this information because laser is so frequently asked. But is laser frequently available in all ENT centers in India, all medical colleges, all tertiary hospitals? Food for thought. CO2 laser clinical uses are transverse cordotomy, excision of vocal nodules, laser tonsillectomy, excision of vocal cord polyps, vaporization of nevi and tattoos by dermatologists, excision of vocal cord cysts, excision of vocal cord granulomas, excision of juvenile laryngeal papilloma, endoscopic partial arytenoidectomy, microflap raising in Rinke's edema, complete arytenoidectomy, leukoplakia, T1 lesion of vocal cord, localized lesion of supraepiglottis and infraepiglottis. This is not an exhaustive list, it's just some of the applications of CO2 laser. CO2 laser therefore can be used in a wide variety of surgeries. Now we talk about safety precautions and complications. Now, before we get into that, we will talk about a little bit about CO2 laser because we are talking about safety precautions and complications largely in the context of CO2 laser. However, it applies to other lasers as well. Wavelength of CO2 laser is 10,600 nanometer. It is invisible. So CO2 laser will require an aiming beam of helium neon laser. If you can't see CO2 laser, you won't be able to focus it on a particular area. You need an aiming beam which has a color. So in this case, helium neon laser is used as an aiming beam with CO2 laser. CO2 laser cannot pass through flexible optical fibers. CO2 laser requires articulated arm with a series of reflected mirrors to direct the beam to the target area. CO2 laser is absorbed by water. It is also absorbed by clear glass, which raises hazards. CO2 laser can be absorbed by the lens of the operating microscope. It can be absorbed by the glasses worn by the operator, which can result in catastrophic damage. Now let's talk about the safety precautions associated with lasers. It is very important to educate staff working with laser regarding the safe use of laser and its hazards. Before we get into safety precautions of lasers, I want to discuss three things that are largely important in terms of safety precautions of lasers. First thing, lasers can damage eyes. Second thing, lasers can cause fires. Third thing, fire is not restricted to one particular object. Fire can be caused by laser anywhere. Laser is light, so you can imagine laser to be like a match. If you have oxygen and an inflammable object nearby, then laser can lead to fire. Okay, so for fire you need an oxidizing agent, you need a substance that can burn, and you need a spark. So in this case the spark is the laser. So it's very important that we don't provide the other two. Okay, we keep the oxygen at a minimum and we don't have any inflammable object nearby. However, these objects are there and fire can break out due to laser. So that is why laser use has a lot of precautions and we need to know about them. So now let's get back to it. First thing is protection of eyes. Now whose eyes? Protection of the eyes of the staff and protection of eyes of the patient. Protection of eyes of the staff using laser is by wearing wavelength specific glasses with side protectors to avoid damage by any reflected rays. Now in carbon dioxide laser, plain glasses can be worn, ND-YAG lasers, blue-green glasses are worn, and argon laser, amber colored glasses are worn. Each laser has wavelength specific glasses. I think I wrote wavelength specific laser available for all. I wrote wavelength specific laser available for all lasers, that's a typo. Wavelength specific glasses are available for all lasers. Now for the patient's eyes should be protected by covering them with a double layer of saline soaked cotton eye pads, and the exposed parts of patient's body should be covered by saline soaked wet towels. Now let's look at what part of the eye can be damaged by which lasers. If the laser has a wavelength of less than 400 nanometers, then corneal opacity and cataract can be caused. Similarly, if the wavelength of laser is more than 1400 nanometer, corneal opacity and cataract can be caused. If the wavelength of laser lies between 400 to 1400 nanometers, retinal damage can be caused. Now, wavelength specific endotracheal tubes are also available. Rubber tubes are better than polyvinyl chloride. I think PVC is that. PVC ones, because PVC are less resistant to laser beam, produce more damage if accidental fires happen, and their breakdown products are also more toxic. Endotracheal tubes can be wrapped with reflective aluminum foils to avoid burns. With ND-YAG laser, colorless or silicone tubes can be used, but they should not have any black or dark lettering or a lead-lined marking along the side. Cuff of the endotracheal tube should be inflated with methylene blue dye, mixed saline, and then covered with wet cottonoids, so that in the event of accidental damage by the laser of the endotracheal tube cuff, blue color will leak out, it will alert the surgeon, and tube can be replaced. Now, inflammable anesthetic gases should be avoided. Which gases are inflammable? Nitrous oxide. Non-inflammable anesthetic gases like halothane and enflurane can be used. Concentration of oxygen to ventilate the patient should be commensurate with oxygenation of patient and should never exceed 40%. Oxygen can be mixed with nitrogen, helium or air. Separate suction tube should be available to remove smoke and steam created by vaporization of tissues. Smoke and steam should not spread into the operation theatre and should not be inhaled by operation theatre staff, because smoke may be mutagenic, it can cause cancer, and has also been shown to contain virus particles from tissue vaporization of viral papillomas. A bowl filled with saline along with a syringe similarly filled with saline should be kept on the table when using laser. Why? What is the role of this bowl? The most dreaded complication of laser surgery is the endotracheal tube catching fire. Now imagine a surgery going on, the patient is breathing through endotracheal tube and the tube itself catches fire. Think of how hazardous that is. So what do you do in that situation? In the event of endotracheal tube catching fire, ventilation should be stopped immediately. Saline should be poured with a syringe and tube withdrawn simultaneously. So you have stopped ventilation, you are trying to withdraw the tube out. The tube is burning. So you have to pour saline as well, because while you are withdrawing the tube out, that burning tube can cause damage to other parts of the body of the patient. Now airway is re-established as soon as possible with a new tube. Bronchoscopy is performed to assess the degree of damage to the tracheobronchial tree, and intravenous steroids should be given. Watchful observation post-operatively must be done with repeat bronchoscopies. Watchful observation of the patient. Now there are some general safety precautions that one should observe when using laser, such as a display sign should be there outside saying lasers in use. The OT door, the operation theatre door, should be closed and no entry or exit of staff should be permitted while lasers are being used. Now, there was a there was a question on ND-YAG laser, so I have talked about it separately here. ND-YAG stands for neodymium, yttrium, aluminium, garnet. It has a wavelength of 1064 nanometer. Easy way to remember is wavelength of ND-YAG is double that of KTP laser. So KTP laser is 532 and ND-YAG is 1064. ND-YAG laser is invisible. It requires separate beam of visible light for aiming. It can pass through flexible optical fibers. So the difference between ND-YAG and carbon dioxide is that ND-YAG can pass through flexible optical fibers, carbon dioxide cannot. ND-YAG can pass through clear fluids. So who absorbs ND-YAG? Pigmented tissue. ND-YAG laser creates nearly 4 mm zone of necrosis and thermal coagulation, both in depth and laterally, that is sidewise. ND-YAG laser is useful for coagulation of blood vessels. Clinical uses of ND-YAG laser are in debulking of tracheobronchial lesions for palliation, in debulking esophageal lesions for palliation, in the treatment of hereditary hemorrhagic telangiectasia, and also in turbinectomy. Now we will talk about tissue effect. Tissue effect can be thermal effect or non-thermal effect. We have previously described that when a laser beam hits tissue, it can be reflected, it can be absorbed, it can scatter, and it can also cause tissue effect. Tissue effect can be thermal effect and non-thermal effect. Thermal, as you know, when the laser beam hits the tissue, the central zone undergoes vaporization. Then we have, if we imagine some concentric circles, the zone just outside the zone of vaporization is the zone of necrotic damage. Then we have the zone of coagulation, and finally we have normal tissue. Now let's discuss thermal effect of laser. The energy of laser is absorbed by chromophores within body tissue and is converted into heat. Heat above 60 degrees Celsius or 65 degrees Celsius leads to cell proteins undergoing denaturation due to coagulation of tissue proteins caused by randomization of protein chains. Contraction of collagen fibers in the vessel wall and perivascular tissue leads to hemostatic effect, that is loss of bleeding, stoppage of bleeding. Heat at 100 degrees Celsius causes drying of tissues, shrinkage of tissues, and permanent damage to tissues. Intracellular water absorbs laser energy, resulting in chemical change in the cell. This principle is utilized in photodynamic therapy for malignant tumors. Thermal effect of laser. Photomechanical effect. So we've talked about the absorption and this tissue destruction. We've talked about photodynamic therapy as a result of thermal effect of laser. Now we talk about photomechanical effect, which is seen when short pulses of high intensity laser is used to disrupt the cellular architecture, such as the one done in lithotripsy. Now there can also be laser induced fluorescence, which is used extensively for detection of cancer. So this was the thermal effect of laser. Now we talk about non-thermal effects of laser. Biostimulation is seen with low levels of laser energy used in sports injuries and rheumatism. So in sports injuries and rheumatism, biostimulation property of laser can be used. This is low levels of laser which stimulates tissue. In ENT, low level laser like helium laser and nitrogen laser is used in acute and chronic inflammations. Last thing we talk about is photochemical effect. Photochemical effect is seen when radiation energy of laser can stimulate or react with specific molecules within a cell to focus them. So this was my answer on laser. I don't think this was the best possible answer anyone could write. I will not tell you where my reference is from, but it is from a reliable book. And I hope you like this answer. If you have any questions regarding laser, or you want to suggest any topic that you want me to talk about in the next video on postgraduate ENT, then I'll be happy to oblige. Take care, bye bye, and please don't forget to be awesome.